President Obama today hailing victory. The Supreme Court has voted in favor of the Affordable Care Act.
Nearly 6.5 million Americans then will continue to get insurance subsidies through the federal exchange. Let's listen to the president's words earlier today.
And today, after more than 50 votes in Congress to repeal or weaken this law, after a presidential election based in part on preserving or repealing this law, after multiple challenges to this law before the Supreme Court, the Affordable Care Act is here to stay. So today is a victory for hardworking Americans all across this country whose lives will continue to become more secure in a changing economy because of this law. If you're a parent, you can keep your kids on your plan till they turn 26, something that has covered millions of young people so far. That's because of this law. If you're a senior or an American with a disability, this law gives you discounts on your prescriptions, something that has saved 9 million Americans an average of $1,600 so far. If you're a woman, you can't be charged more than anybody else, even if you've had cancer or your husband had heart disease or just because you're a woman. We can see how it is working. This law is working exactly as it's supposed to. In many ways, this law is working better than we expected it to. For all the misinformation campaigns, all the doomsday predictions, all the talk of death panels and job destruction, for all the repeal attempts, this law is now helping tens of millions of Americans.
Earlier, we spoke with Major Garrett about what this victory means for the Obama administration.
Well, certainly, and what the president is telling his political opponents, of which there are many Republicans who are seeking the Republican presidential nomination, this argument over the Affordable Care Act is over from a legal perspective. And if you want to change this law, you're going to have to first be elected president and have a Congress that's going to rewrite it in a way the American people support. And the president believes that the status of the law, as experienced by consumers who were uninsured before, provides exactly the kind of political protection he needs and the Affordable Care Act itself needs to avoid just that kind of Republican political aggression. Now, the president well knows that there are still parts of the country where this law is unpopular, but it is becoming gradually more popular as it is implemented. There are still clearly problems with premiums in some areas and access to care in some areas, but the president believes the court action seals off for good any more significant legal challenges to the underpinnings of the law, and now it's all about a political dialogue about what the law is either accomplishing or failed to accomplish, and most importantly, what is your alternative to what exists now and has been upheld not once, but twice by the Supreme Court? So the president really described today as a legal victory that will have a long and cast a very long political shadow as well.
In the last presidential election, Major, we saw a lot of vehemence at these town hall meetings where people were fighting over health care reform and repealing it. In the lead up to passing health care reform, you saw a lot of angry Americans. But it seems like some of the passion, some of the vehemence about this has somewhat subsided. Does that change how important this issue becomes moving forward into who leads the nation, both in Congress and in the White House?
Well, a lot of times in politics, and I've watched this in a lot of different battles, vehemence is no substitute for ideas. And what Republicans and opponents of the Affordable Care Act have really not brought to the table is a comprehensive alternative. And yes, anger has subsided for a couple of reasons. You now have 2 Supreme Court rulings that say the law is constitutional, so it can't be challenged there. And the political disquiet, if you will, over the Affordable Care Act has actually evidenced itself in 2 midterm elections. Democrats lost a great number of seats in 2010, lost control of the House of Representatives, and then they lost control of the Senate in 2014. So the politics of the Affordable Care Act have not always worked to the Democrats' advantage, but they have one thing that they have used consistently, which is a Democratic president who signed the law into effect and would never accept any efforts to undermine it legislatively. So in 2016, the conversation becomes President Obama is now off the stage. Republicans will look for the Republican nomination. Hillary Clinton, the front runner for the Democratic nomination, clearly subscribes to the Affordable Care Act, wants to keep it, will campaign on behalf of keeping it. So the argument will be, what is an alternative to the Affordable Care Act, and can Republicans drive that message home in a way that's persuasive enough to get them a nomination and then the presidency?
Major, I want to turn to back to the opinion, because in addition to the majority opinion, of course, there was the dissent. And it was interesting. I just saw that you tweeted out a short time ago the phrase jiggery pokery. You said, come on, tweets, make jiggery pokery top U.S. search trend on Google. Now, you're referring to Justice Scalia there
right.
in his dissent, forcefully arguing against what the majority argued here. So I guess what I'm wondering is, how does that, we talked about vehemence not necessarily being a substitute for ideas, but what is it that you think this will do to shape that political conversation? Because clearly you even heard Chief Justice Roberts in this majority opinion write that the Affordable Care Act contains, quote, more than a few examples of inartful drafting. And so therein lies the openness to interpretation that Justice Scalia so passionately argued in his dissent.
Exactly. And Judge Roberts and the six-judge majority, which he wrote on behalf of, also conceded that there were ambiguities in the way the law was drafted and written. And those ambiguities had to be fleshed out by the High Court. And it came down on the side of maintaining what it believed Congress's intent was when it came to the central question of state or federal exchanges and the tax subsidies that give people breaks on the premiums they pay to obtain health insurance for the first time. So the High Court acknowledged that this law is not written in the clearest language, and what the majority said is that we are going to look at that language and the underlying intent and the actual implementation of the law to find it constitutional. Judge Scalia, in his very stinging dissent, said that's not what the court is here to do. The court is here to interpret language as written and its consistency and application of constitutional rights as we've decided them to be through precedent or not. That's it. It's not to worry about whether or not millions of people will lose their health insurance or what will the overall political repercussions or practical repercussions of our judgments will be. Our job at the court is to interpret the Constitution, legislative language, and its adherence to the law. And Scalia said this court majority did not do that. That will give conservative critics of this law a toehold to continue to attack what the court did and what the law says. But as I referred to earlier, and Republicans in private do concede this point, they have to come up with an alternative that is persuasive to enough people to replace the Affordable Care Act, because legal challenges have not done what they hoped they would accomplish. So now this becomes a conversation in a presidential campaign, and after that, if they win the presidency, a conversation between the House and the Senate and what comes next.
Major Garrett from the Rose Garden at the White House. Major, thanks a lot.